Welcome back to Lesson 2 in the Lung Coach Asthma Education Home Study course. In this lesson, we are going to be talking about the diagnosis and severity of asthma, two very important factors when first planning on a plan of care to manage your asthma. Now, in this lesson, we're going to be talking about signs and symptoms of asthma. We're going to be talking about lung function and lung function testing. And we're going to be talking about classification of asthma, which includes 4 classifications: intermittent, mild persistent, moderate persistent, and this bottom one, if you can read that, is severe persistent. And that is from the National Institute of Health's classification of asthma, which helps determine how your doctor will treat your asthma. Or your child's asthma. And they actually adjust for children who are 5 and younger, children for ages 5 to 11, ages 12 to 18, and then adults. So it's even specific to age group. But one of the things they're going to look at in this is symptoms and how often you experience symptoms. And asthma symptoms can include shortness of breath, chest tightness, wheezing, an audible sound that you can hear when you inhale or exhale, or both, and mucus production with a cough, or even just a cough without mucus production. Those are classic signs of asthma. For children who are not diagnosed with asthma, ages 5 and under, you can also look for other signs and symptoms of asthma, which could be eczema. Young children, 2 and 3 years old, I've treated children who are covered in eczema during times that they're also having asthma exacerbations, or asthma attacks is what that's known as. So if your young child has a rash or eczema, you also want to be extra careful to watch their breathing and any signs of trouble like wheezing or a cough. They also can get retractions in their muscles when they're breathing in and out. So you might see their ribs when they're really struggling. So those are signs and symptoms of asthma. But when you go into your doctor for the very first time with your child, or maybe you as an adult, he's also going to do some lung function testing. And they may do this in what's called a plethysmography box, when they do a complete pulmonary function test, or they may use a smaller bedside unit to test just a couple of measurements in your lungs. One of those could be your peak expiratory flow rate, and that is a device you can also measure at home with a cheap peak expiratory flow meter, and I'm going to show you how to use that in other lessons. But for right now, just know we're going to look at some lung function. And then they're going to classify you based on your symptoms and your lung function into these 4 categories. For example, intermittent means that you do not have symptoms more than 2 times per week. You do not have night awakenings more than 2 times per month. And you do not use your rescue inhaler, which is your albuterol. Other names for the rescue inhaler are Preventol or ProAir. You do not use that more than 2 days a week. And that's intermittent asthma. And for that asthma, you have normal lung function for the most part. So a lot of times they don't have you on maintenance medication, such as steroids, inhaled steroids, or anti-allergy medications like antihistamines, anti-leukotrienes, or you can have leukotriene modifiers, or other. Those are technical names for some medications I'm going to talk a little bit more about later. But for the most part, we're gonna talk about your rescue inhaler, how often you're using it. If you use your rescue inhaler more than 2 days a week, but not daily, that puts you in the mild persistent category. Mild persistent asthma. If you use your rescue inhaler daily and you have symptoms more than you're having symptoms daily, that puts you into moderate asthma. And if you have symptoms throughout the day and have to use your rescue inhaler multiple times a day, that puts you in the severe category. And you probably need to be on maintenance medications, and your doctor will tell you which ones are appropriate for you. So that is how healthcare providers, doctors, respiratory therapists, nurses, and other providers will classify the severity of you or your child's asthma based on your symptoms and your lung function. So this is very important for that first visit, which I mentioned in the first lesson. And we're going to talk about waking up, how often you're waking up every month as well. And when your lung function starts to decrease, like this level at moderate persistent, your lung function can be 60 to 80% of normal. So that's a time when you might have to be put on an inhaled steroid or some type of maintenance medication. Sometimes they have long-acting bronchodilators, which we're gonna talk all about that a little later in the lesson here. So once again, we're gonna finish with a type of lesson, and what I want you to do is go online. I'm going to put some links on the website to find a peak flow meter diary or log. This is a tool you're going to need to monitor your own lung function after the diagnosis of severity. So it's called a peak flow log or a peak flow meter log or diary. There's tons of information at asthma.com, asthmaandallergyfoundation.com. National Jewish Health is another great resource. That's the hospital that I actually work at. I don't represent the values or none of these lessons or anything. That's my disclaimer there. But they have a lot of great information on their websites about asthma, controlling asthma. So even if you can't make it to Denver to see those great doctors, you can download a lot of their tools from their website. So go ahead and look for a peak flow meter diary or log, and I will see you on lesson 3, where we talk about a little bit more of measurement of lung function. Thank you.